Hi, I'm Lieve with Professional Equine Grooms, and let's talk about how to integrate your horse's health care into your grooming routine. Because when you think about it, horse grooming is actually horse health care. And the first thing I like to do to check up on my horse's health is take the vital signs. That is the temperature, the pulse, the respiration. I'm also going to look at the gums, not only for color, I'm going to see how moist they are, and I'm also going to see what the capillary refill time is. And last but not least, I'm going to check the digital pulse, which is an indication of what's going on inside the hoof. Now, this only takes less than 3 minutes during your horse grooming routine, and it gives you a chance to get your eyes and your hands on your horse. It's easy to take your horse's temperature. Two simple tools that you need. You need some lubrication and you need a thermometer. This is a battery operated thermometer. They're great. They take the temperature very quickly, but the batteries can sometimes peter out on you. So I always recommend having a non-mercury shakedown thermometer just in case. And after you have some nice lubrication on the end of this thermometer, stand next to your horse. This is really important to be safe. And all we're going to do is we're going to move their tail aside with your hand and then slide the thermometer into the very end of their digestive system where the poop comes out. Then you get your horse's temperature reading. And a normal temperature for a horse is going to be between 99.5 and 101.5. And you should know what your horse's base temperature is when they're resting in the morning and in the evening. And then just for funsies, you could start to take it after you come back from a ride to see how their exercise influences their temperature. We also want to check our horse's pulse. This is their heart rate. And you can do that with a stethoscope behind their elbow. I've always found that to be really tricky to find. So I prefer to use the facial artery that comes down around behind this cheek. And you press your fingers just to the inside of that area until you feel like a string or almost like a guitar string. Press down halfway, use a timer, and count how many thumps per 30 seconds, multiply by 2, and that gives your horse's heart rate per minute. And normally this is going to be between 24 and 48. And that is their normal at rest. Obviously, if they've been running around with their friends or they're coming back from exercise, it's going to be elevated. Always good to check that as well. To check your horse's respiratory rate, it's really easy. You just need your eyes and your hand. You're going to want to come back here. The end of your horse's lungs is back here. And where the flank kind of changes direction with the hair, you can visually see them inhaling and exhaling. And one big inhale and exhale is one breath. So you can put your hand here and you can watch, count for 30 seconds, multiply by 2. And a horse's normal resting respiratory rate is between 8 and 24 breaths per minute. Your horse's gums can tell you a lot about their circulatory system and their overall health. And the first thing I do is I just want to take a peek and make sure that they are a pale pink color. And that's easy. You just kind of have to pull back the upper lip and see that it's a nice pale pink color. Now I want to make sure that my horse is hydrated. And yes, you can pinch their skin and see how quickly that snaps back. That's not super accurate because just like people, the older a horse becomes, the more collagen and elastin in their skin is not there, and their skin gets a little extra saggy and floopy. So I prefer to check for hydration by feeling their gums, and I'm just going to run 2 fingers in between her upper lip and her upper teeth. Very slippery. That's what you want. Sticky or dry gums indicate dehydration. Now I'm going to test the capillary refill time, and I'm just going to press my thumb into the gums. It's going to turn white, and I'm going to count how many seconds until that gum color returns to pink. Ideally, you want it to be about 2 seconds. And this test measures how efficient your horse's circulatory system is. How quickly is the blood returning into the smaller vessels? A longer capillary refill time is also an indication of dehydration because as a horse's body overall loses water, their blood loses water. So there's not as much volume and it has a harder time refilling after you've pressed down into those capillaries. If you find that your horse's gums are any color besides pale pink, there's a couple of things those different colors can tell you. Really pale gums or almost white gums indicate anemia, which is a lack of red blood cells in your horse's body. A horse that is in shock or has generally poor circulation is also going to have pale pink or white gums. Now, if you find the opposite and your horse's gums are bright red, that could indicate a fever, heat stress, or generalized inflammation somewhere in your horse's body. Dark or blue or purplish colored gums indicate a serious problem with their respiratory and or cardiovascular system. This is an emergent situation, so you need to call your vet. And this color happens when the blood lacks oxygen. And if you find yellow gums, this is a sign that something's going amiss with your horse's liver. Let's talk about your horse's digital pulse. Along each leg between the pastern and the fetlock, there are digital arteries and digital veins that go down into the hoof. When the blood flow in the hoof is perfect and there's no inflammation and there's no injury, that digital pulse is not going to be noticeable. And if it is noticeable, it's typically really faint. That's because the vessels in the hoof have clear traffic. There's nothing jamming up the blood vessels. Now, when there is a problem inside the hoof, it could be an abscess or a bruise or laminitis or any sort of hoof injury. The swollen tissues inside the hoof will start to constrict the blood flow and reduce the size of those vessels. So the blood going into the hoof has a really hard time getting in and going out. There's a traffic jam in that hoof. And so it starts to back up. And then the digital pulse, you're going to feel it. It's going to start to maybe bounce a little bit. Sometimes you might hear a vet call it a bounding pulse where it's very strong. And that indicates something inside the hoof is wrong. How do you check your horse's digital pulse? I like to combine it with feeling the tendons on their legs to make sure there's no cuts, scrapes, or inflammation. And I run my fingers down the leg. And when I get to the fetlock, I kind of hook under a little bit. You might find a soft, squishy pad. When you roll your fingers side to side, you're going to find what feels like tendons or like more guitar strings. That's the digital artery in the vein. And then you press about halfway and see if you can feel anything. If you can, something's going on. If it's normal, then it's normal. Check all four. Before I start grooming, I'm going to use my hands and my eyes to check over my horse's entire body because I want to see if there's anything different from the day before. And I'm looking not only for things that I feel, I'm also looking for my horse's reaction. So, do I feel any cuts, scrapes, swelling, lumps, bumps, insect bites, or even ticks? And is my horse giving me any signs of discomfort? Are they gnashing their teeth? Are they swishing their tail? Are they stomping? Do they have a sour expression? Are their ears pinned back? I'm also checking eyes and nostrils to make sure that there's nothing abnormal being discharged out of them. Sometimes horses naturally have a little bit of discharge around the eye. If it's different from the day before, you're noticing a pattern where it's increasing or it's different colors or there's more mucus and things coming from their nostril. These are all parts of the bigger picture that you and your vet can discuss. I'm also checking the major muscle groups on my horse. Are they responding well to pressure? Is there flinching? Are they sensitive or sore? And I pay special attention to the saddle area, specifically because saddle fit is really important. And a horse is using their back through all different types of exercise, regardless of the discipline that you ride. So it's important that this uniting factor, their back muscles, stays healthy and sore, and not sore is what I meant to say. Healthy and not sore. And as you're spending time at the barn, it's great to know your horse's normals inside and out. That way, that is a sign if something is going amiss. They're going to tell you long before they send you an email that says, I don't feel so great. Their vital signs will tell you. But you don't want to stop there. You also want to take a look around your horse's environment and notice things that might be a little bit different. And I'm specifically talking about inputs and outputs. Inputs being water and food. Are they drinking the proper amount of water? If you use automatic waterers, you can get separate measuring devices that are reset every day so you can track how much your horse is drinking. Or you can use big muck tubs that have little hash marks inside them that tell you how much they've been drinking, or you can just count how many buckets you've had to refill. As far as their inputs, like their hay and their grains and their forages and things like that, are they eating normally? Are they dropping anything out of their mouth? Are they maybe eating less? Are they spinning it around more in their stall? Are they dragging it places? Are they not eating as much as they normally do? Or are they eating really fast? All of those little signals that your horse gives you more information about how they're feeling. It might also give you information about what they think of their water. Is it dirty and you need to clean it more often? Or their hay, is it a new batch and maybe they don't like it as much? When it comes to water, horses have this really interesting kind of habit. Most horses will prefer to drink cold water, but they will drink more water if it's warm. And this is especially important in the wintertime when you want to keep them as hydrated as possible. It takes a lot of energy to keep your horse warm in the winter. And if given two water sources, a cold water source and a warm water source, most are going to pick the cold, but they're not going to drink as much. So if possible, provide warm water for your horse. Now let's talk about your horse's outputs, meaning their urine and their manure. Are they passing manure in the same places with the same frequency? Is the texture the same? Is the water content the same? Have they decided to find a new place in their paddock to do their business? Again, all of these are clues as to your horse's internal health. Same goes for your horse's urine. Is it consistently the same color? Is it consistently the same amount of foam? Are the locations pretty similar to where your horse likes to urinate? And is your horse urinating as frequently or not as frequently as normal? Sometimes horses, when they are uncomfortable in their digestive systems, will urinate small amounts very frequently as an attempt to relieve pressure in their bellies. So now that you have all this information, their vital signs, what's going on inside their hooves, are they eating, drinking, peeing and pooping as normal? If something is different than it was the day before, don't fixate on that one particular thing. Take that bigger, wider angle approach to gather more information, because if you need to talk to your vet, then you have a more appropriate way to figure things out. Like, for example, if you notice that your horse's temperature is normal, but their heart rate's a lot higher than what you would expect for that time of day, ask yourself if your horse is in pain, which can sometimes elevate their heart rate, or have they just been running around? Also kind of want to keep track of how your horse is moving. And sometimes that's easier said than done. As most horse owners, we lead our horses around. Start to memorize what that sounds like. Start to glance back and see how far their hind leg steps up towards the footprint of their front leg. If a horse doesn't feel great in their digestive system or in their hooves, their gait is probably going to be affected. And you might see that. You might hear a change. You might notice that they are not tracking up as much as they normally do. You might also notice that horses typically have one way of turning around in a small space, but all of a sudden they're a little bit more stilted and it's harder for them to swing around. You might notice that they're hesitant from moving from one particular type of footing to another. For example, going from a cushy stall with lots of shavings into an aisleway that's a little bit harder, or moving from an arena that's nice and soft and cushioned into a path around the farm or a trail. You might also smell something weird going on in your horse's hoof, or you can see something strange. Maybe there is an obvious stone in there. Maybe there is a foreign body like a nail or a screw. P.S. Don't pull those out. Call your vet first. And here's the real conundrum with hoof problems. Most hoof problems look exactly the same. Laminitis looks like an abscess, which looks like a stone bruise, which looks like a fractured coffin bone, which might look like a street nail, which is just slang for having a foreign body inside the hoof capsule. Hot nails, quarter cracks, these all kind of present the same way. And it's really tempting to call your farrier first. Obviously, they are an expert in the hoof and can help you, but your veterinarian can diagnose what's going on, can give your horse appropriate pain medication to make them comfortable as soon as possible, and take x-rays to see what's going on inside the hoof. Then your vet, your farrier, and you can get together, form a treatment plan, and your farrier can help you execute that plan. When it comes to hoof problems, you really don't want to wait on anything because they can go sideways so quickly and they're often very painful for your horse. As you're grooming your horse, be on the lookout using your eyes and your fingertips for common horse skin problems that sometimes will pop up. Horses can be susceptible to bacterial infections, fungal infections, allergies to insects and otherwise, and a whole slew of things. But if you're grooming every day and you're using your hands and your eyes and you're listening to your horse's body tell you what's going on, you can narrow down quite a few different kinds of ailments. One being hairless skin, patchy skin, scaly skin, little clumps of hair being pulled out, or scabs indicate some sort of bacterial / fungal infection. Obviously, it's best to get your vet on board to help you determine what it is so you can treat it appropriately. You might also find your horse is itchy. Is it localized? Is it everywhere? Is there anything going on with the itch? Are there hives or big welts? Are those localized or are they everywhere? Is this a new itch? Is it a seasonal itch? Could it have been a tick bite or another type of insect? Sometimes hives and welts are due to an allergic reaction to something. It could be something external, meaning an insect or something in their environment that they have been groomed with or that they have rolled in or that is in the air around them. Some horses are really sensitive to dust and pollens. Allergies can also stem from something that is internal. Maybe they've eaten something in their feed or their hay or their pasture or a treat that isn't sitting well with our digestive system and they're having an allergic reaction, and you're going to see the results of that. Generalized itching can also be the result of sweet itch, which is a reaction to those teeny tiny little midges that come and land on your horse's dorsal side, typically between the poll and the tail. Creates a big inflammatory response in your horse that's really itchy, and they'll do anything to relieve the itch. And then that creates sores, which scab over, and that itches more, and then there's more bites, and it's a cycle. So anytime you find something new on your horse's skin, again, take a step back, collect more information, see what's been going on with your horse's behavior and their environment, and then talk to your vet about possible diagnoses and treatments. And then, of course, you have your generic equine pastern dermatitis, which is also known as mud fever or scratches. Typically, it's caused when there is a bacteria and or a fungus, plus moisture, plus being trapped against your horse's skin. It's really common on the lower legs. Sometimes it is a simple bacterial infection. Sometimes it is a sensitivity to UV light, either because of a liver problem or something they've eaten. So it's always helpful to stay ahead of those types of situations with the help of your vet to clear them up so they don't keep spreading up the leg. There are a lot of topical products that you can use to help your horse be more comfortable if they have a more sensitive skin type. One of them is a shampoo that has some lemongrass and tea tree oil in it. That's very soothing, can help repel flies, and it also just makes the skin feel better. It smells great. And then there are topical oils that you can use. Some are used for hair conditioning and creating shine. Others have medicated ingredients in them that can help clean up skin issues and protect the skin from further skin issues and assist in hair growth. What kind of things can you find on your horse's legs when you're grooming? Well, the big things to look out for are going to be heat and swelling, and it might be a little bit of swelling or it might be the entire leg or somewhere in the middle. And sometimes it's a more localized area, in which case you could clip it, clean it, and see if there's a wound under there that needs to be treated and protected from turning into something bigger. Have you noticed anything happening with your horse's splint bones? These are the two bones on either side of your horse's cannon on all four legs. And these bones are very skinny and they're very long, and sometimes when they are knocked, they will either fracture or completely break apart and create a nice hard nodule. Some horses feel no pain, other horses are obviously lame because of this. And because there's so many different things that could happen with your horse's splint bone, even if your horse doesn't feel any pain, it's a great idea to have your vet come out and take a radiograph, an x-ray, to make sure there's not a fracture going on in there. Depending on the severity of the injury, maybe they just need some time with some icing, maybe they need to have it surgically removed, but you never know until you get the x-ray done. You also might find hock sores, which are open wounds on your horse's hocks. They also happen on fetlocks and knees, and as your horse lays down and gets back up again, there is a little bit of friction on those parts of your horse's legs that can turn into an open sore. You might start to see a little bit of hair loss, and then over time, the skin starts to slough away. You need to clip and clean those areas and then cover them. You can get protective hock wraps as well to help prevent that from getting worse or happening in the future. You can get pastern wraps, you can get knee wraps, all sorts of things to give a layer of cushioning between your horse and whatever it is they love to roll on. You might also find stuff going on in the hoof. If your horse has a coronary band injury, there is a chance that's actually going to translate into a hoof problem because the coronary band is the source of hoof growth. Which means if you notice that your horse has vertical cracks in the quarter of the hoof, it started up in the coronary band. You might also see open, kind of like horizontal little openings at the coronary band, and usually that is called a gravel, where an abscess has actually worked its way up the hoof and come out the coronary band, and you'll see over time that little horizontal line will start to grow out. And then of course, as you're picking hooves, do you notice any loose nails? Is the shoe secure? Is there any funky smell that might indicate thrush? Are you seeing little vertical cracks along the edges of the hoof, which create an opening for a white line bacterial infection to start happening up in that hoof wall? Anything abnormal? Let's talk manes and tails for a minute. So we talked about the kind of bugs that you might find in your horse's mane and tail, like the mites and the lice and the ticks. You might also find some dandruff, which can be caused by really oily skin. It can be caused by really dry skin, might be a skin infection. It might just be extra product that wasn't rinsed out at your horse's last bath. It might be a seasonal thing. They might have a dietary deficiency where they're maybe needing a little bit more omega fatty acids to support their skin health. You might also find that things are just generally itchy, and sometimes that is because of a tick, and sometimes it's because they need a sheath or an udder cleaning. Sometimes it's because they have pinworms living in the distal end of their digestive system that come out at night and leave their sticky little eggs underneath your horse's tail. Of course, your vet can help you with the diagnostics and the prescription to get that taken care of. These things are just things that you can notice and then help your horse be more comfortable with. You might also find in your horse's mane and tail tangles, or wind knots as they're sometimes called. And these can get progressively worse over time. Sometimes a horse will come back from their pasture and they'll be covered in burrs. And it's best if you can take these out with the help of a grooming oil. The more oil you can pour on these things and let it soak in for a little bit, you can then just peel the knot apart and save a lot of that mane and tail hair from getting snapped. Grooming oils are also a wonderful conditioner and detangler for your horse's tail. Use about a dollop, a quarter size little drop in your palm is enough to condition your entire horse's tail. And this helps prevent stains from setting in. If it's a light colored tail, it also helps prevent tangles and makes everything very slippery and shiny and healthy. All of the things we've talked about can help you track your horse's health overall as you're grooming and getting ready. But how do you track your horse's fitness when you're riding? Well, a key indicator of fitness is heart rate and vital signs. So what we want to do is we want to look for trends over time. And taking your horse's vital signs before you ride and after you ride, immediately when you're done, can give you an idea of how hard they have worked. Now, a horse's true fitness level can be seen in how long it takes for that vital sign measuring at the end of exercise to return back to normal. So as you're finished exercising, and you might want to do this before you do your cool down even, get a quick pulse rate, and then every 3 to 5 minutes, take it again. And note the time it takes to go from post-exercise to back to normal. And as your horse's fitness increases, that amount of time is going to start to get a little bit smaller. And now, of course, your workout every day is going to vary just a little bit. But if you have a very similar routine day to day, then you can start to measure your horse's fitness over time. There are also wearable devices that connect to your cell phone that your horse can wear on their girth that give you biometric feedback from your horse's heart rate and sometimes even the patterns that they have worked on the ground and how many steps they've taken. And that all plugs into an app where you can see trends over time. Let's talk about some horse fitness myths and some health myths. One of them is a foamy horse is overworked. Now, in a horse's saliva and sweat, there's a protein called latherrin. And when latherrin is exposed to friction, it creates foam. Every horse is going to have a different amount of latherrin that their body produces in the saliva and the sweat, which is why some horses get really, really foamy with a little bit of friction and others don't get foamy hardly at all. And latherrin is a way to help your horse digest their food. That protein helps in the digestive process. It also helps in the cooling process because it helps coat the individual hairs on your horse's coat to help them evaporatively cool better. Now, as you are riding along, anytime your horse has sweat, there's a certain amount of latherrin in it. And as tack rubs against it, as your horse rubs his hind legs together, as the reins work on your horse's neck, that can start to foam. You might also see it in your horse's mouth when that saliva is mixed with friction as your horse is gently chewing the bits, and they might get a little foamy mouth. Some horses foam when they're eating. This is not a sign that a horse is overworked or in danger of overheating. It simply means they have latherrin in their saliva and sweat, and there is friction. That is all. Speaking of sweat, the amount that your horse sweats is not indicative of how hard they have worked. A lot of things go into how much a horse sweats. 1, genetics. 2, the temperature. 3, how much humidity is in the air. 4, what they've been doing for work that day. And having a wet saddle pad or not wet saddle pad doesn't mean that your horse worked more or less. You want to be tracking those vital signs, that heart rate, that pulse, and seeing how they're returning to normal after exercise. It's also important to know that sweat can be an indicator of other kind of bigger problems. Some horses do not sweat at all, which is a condition called anhidrosis, and needs to be managed very carefully, especially during the summer with exercise. There's also partial anhidrosis, where a horse's sweating patterns might not be typical or less than what they normally would do. Some horses sweat a lot. But one thing is really, really interesting. As a horse, as their body temperature starts to increase and tips into that danger zone of hyperthermia, where they're just so warm and danger is right around the corner, many horses will stop sweating. So if you notice that your horse has changed their sweating pattern, again, go back to those vital signs. Make sure their body temperature is safe and normal. And if it's not, talk to your vet. Have them help you, give you the tools to take care of your horse's body temperature. Another giant myth about horse care is that you shouldn't let your horse have water after exercise, and that is just plain wrong. Absolutely, positively, it is safe for your horse to have water after exercise. That's it. It's safe. You should always offer your horse water after exercise as well. So healthcare is grooming, is fitness, is healthcare is grooming. It all works together. And the whole purpose of this is you start to really memorize your horse inside and out, not only what their body is doing, but what their body language is telling you, and their actions and their habits and things like that. And it's not just a thermometer, it's big picture things and it's little picture things, and they all come together to help you keep your horse healthy and ahead of that curve.